My name is Dr. Schneevoigt. I am a specialist in urology and andrology. I have been working at the urology clinic Wienerplatz for about 5 years. I completed my residency at the University Hospital Großhadern in Munich. When we talk about prostate cancer treatment, the first thing we have to do is determine what stage of oncology we are dealing with, whether the tumor is localized or whether it has already spread beyond the prostate to other organs. Prostate cancer most commonly metastasizes to the bones and lymph nodes. New treatments for metastatic prostate cancer are now available. First of all, it is worth talking about the treatment options for localized prostate cancer. These include a radical prostatectomy, I.E., surgery to remove the prostate gland, which is now mainly performed using the Da Vinci robotic system. Other treatment options include percutaneous radiation therapy, in which radiation is delivered to the tumor from the outside through the skin, and brachytherapy, in which a radiation source is placed directly in the prostate. These are classic therapies that are used as curative treatments. There are also new treatments such as focal therapy, which is used in the early stages of cancer. What does that mean? It means that the tumor has low aggressiveness and is localized to a specific area of the prostate. Focal therapy is only indicated for patients with such tumors. On the other hand, there are new treatments for metastatic prostate cancer. When the tumor has reached an advanced stage and has spread to the lymph nodes and other organs. Other novel therapies are worth mentioning. Innovative medications are already available to patients. We know that the growth of prostate tumors is influenced by the male sex hormone testosterone, and the classic method of treating the spread of metastases is to suppress the production of this hormone in the testicles. New drugs are now available that target the androgen receptor signaling pathway, allowing for long-term androgen deprivation. These drugs are used when the classic method of suppressing testosterone production in the testicles is no longer effective. The tumor becomes so clever that it is able to evade the effects of anti-hormone drugs, so another treatment becomes necessary. New drugs are divided into several groups. They can be taken orally. There is also a relatively new type of therapy for the treatment of metastatic prostate cancer called radionuclide PSMA therapy. PSMA is a protein on the surface of prostate cells that cancer cells can synthesize. Consequently, when PSMA binds to certain ligands, there is an opportunity for localized destruction of cancer cells. This approach can also be used to diagnose metastatic prostate cancer, for example, by labeling PSMA with a radiopharmaceutical during a computed tomography scan to assess tumor spread. Physicians can also take advantage of this approach by attaching PSMA to a radiation source, which allows localized irradiation of cancer cells. The third new method of treating the metastatic form of the disease is related to genetics, because in about 30% of cases genetic abnormalities cause the development of prostate cancer. Patients can undergo genetic testing to find out if they have these genetic abnormalities. We are talking about the so-called BRCA1 and BRCA2 genes. If such gene abnormalities are present, we can prescribe a new drug. It's called olaparib. It is a PARP inhibitor that acts on the tumor DNA and suppresses its repair mechanisms. These are the very latest treatments currently being used for metastatic prostate cancer as an alternative to classic chemotherapy.
What minimally invasive treatments for prostate cancer can you offer as an alternative to a prostatectomy?
If the tumor is localized and has not spread, doctors always perform a prostatectomy. Alternatives include watchful waiting and focal treatment methods, but these are used only when the tumor is not highly aggressive, is localized to only one area or lobe of the prostate, and the risk of metastasis is minimal. Watchful waiting may be used when patients' comorbidities do not allow for surgery or when patients are uncomfortable with the potential side effects of surgery. Tumor growth can then be monitored with certain diagnostic tests. If the tumor grows, the patient can undergo curative treatment. On the other hand, there are modern treatments, especially focal therapy, and it is given special importance. There are two main types of these treatments. The first is high-intensity focused ultrasound, HIFU. How is it carried out? An ultrasound probe is inserted transrectally and delivered to the prostate gland. The procedure is performed under local or general anesthesia. The treatment is carried out under MRI guidance. This allows the exact location of the malignant focus to be determined and targeted with ultrasound beams. These ultrasound beams converge at a single point, so to speak, forming beams of ultrasound waves, as a result of which the focused ultrasound generates thermal energy that is directed at the tumor focus, thereby destroying cancer cells. Another focal therapy method is photodynamic therapy. It is known as the TOOKAD method. In this treatment, a light-sensitive drug is injected intravenously. Laser fibers inserted into the tumor then stimulate the drug, resulting in necrosis of the cancer cells and destruction of the tumor. These two methods of focal therapy are the most commonly used. The focal therapies mentioned above are not performed on an outpatient basis. Patients are referred to a specialized center that offers this type of treatment. The procedures can be performed under local anesthesia, in some situations on an outpatient basis, but more often they are still performed in a specialized clinic. If patients are interested in this treatment, we refer them to our partner clinics that specialize in this area of urology. Regarding the new method of focal therapy, it should be noted that only a limited number of patients are suitable candidates for this treatment. This is due to the fact that the oncopathology must be detected at an early stage in order to have time to refer the patient to a specialized clinic, which rarely happens. In my opinion, the most serious side effects of radical surgery are erectile dysfunction and urinary incontinence. These can be avoided by using focal therapy methods because they are non-surgical procedures. Focal therapy allows specialists to preserve the integrity of the prostate gland. It is specifically aimed at destroying cancer cells, so the risk of developing erectile dysfunction and urinary incontinence is almost zero.